Panic attacks and panic disorder are both conditions associated with intense fear and discomfort, although they differ in their frequency and impact on daily life. A panic attack is a sudden episode of overwhelming fear that triggers severe physical reactions without any real danger or apparent cause, often mimicking symptoms of a heart attack, such as rapid heart rate, sweating, shaking, shortness of breath, and a fear of losing control. Panic disorder, on the other hand, is characterized by recurrent panic attacks and persistent concern about having more attacks, leading to behavioral changes or avoidance of certain situations. Treatment for both conditions may include psychotherapy, such as cognitive behavioral therapy, and medication, particularly selective serotonin reuptake inhibitors, SSRIs, or benzodiazepines. Risk factors for developing panic attacks or panic disorder include genetics, stress, temperament, and changes in brain function. Here's a detailed look at the nuanced aspects of these distressing conditions and their implications on individuals' lives. Onset pattern: sudden episodes versus recurrent condition. Panic attacks are intense bursts of fear or discomfort that develop suddenly, typically reaching their peak within minutes. These episodes can occur unexpectedly or be triggered by a stressor and are not necessarily indicative of a larger condition. However, when panic attacks are recurrent and persistent, and there is an ongoing fear of having future panic attacks, this might suggest the presence of panic disorder. Panic disorder is a chronic mental health condition characterized by a pattern of recurring panic attacks and persistent worry about additional attacks occurring. The individual may also exhibit behavioral changes in an attempt to avoid situations that could potentially trigger another attack, indicating a more profound impact on daily functioning compared to a single isolated panic attack. Duration of symptoms: minutes to hours versus months with recurrent episodes. When distinguishing between a panic attack and panic disorder, duration and frequency of symptoms are key. A panic attack is an intense surge of fear that reaches a peak within minutes and includes symptoms such as palpitations, sweating, and fear of losing control. In contrast, panic disorder encompasses recurrent panic attacks combined with persistent concern about having further attacks, worry over the implications of the attack, or significant changes in behavior related to the attacks. These worries persist for a month or more, indicating an ongoing issue. In essence, while a panic attack is an isolated incident, panic disorder is characterized by its chronic nature, with episodes occurring over an extended period, disrupting daily life and mental well-being. Trigger dependency: specific stimuli versus spontaneous or unpredictable. When distinguishing between panic attacks and panic disorder, the differential diagnosis often hinges on the factor of trigger dependency. Panic attacks are intense surges of fear and discomfort that typically peak within minutes. They can be associated with specific triggers, such as phobias or stressful situations. In contrast, panic disorder is characterized by recurrent, unexpected panic attacks and persistent concern about having additional attacks or their implications. This means a person with panic disorder may experience spontaneous or unpredictable panic attacks without an obvious cause or stimulus, leading to a continuous state of anxiety and fearfulness about the possibility of future attacks, which can severely impact their daily functioning. Frequency of episodes: isolated incidents versus repeated episodes. Panic attacks are sudden, intense surges of fear, panic, or anxiety that can be overwhelming. They often include physical symptoms such as chest pain, heart palpitations, shortness of breath, dizziness, or abdominal discomfort. Meanwhile, panic disorder is characterized by recurrent, unexpected panic attacks, alongside persistent concern about having additional attacks or behavioral changes designed to avoid them. The key distinction lies in the frequency and the anticipatory anxiety that accompanies panic disorder. While isolated panic attacks might occur in response to specific stressors and not recur, panic disorder involves ongoing fear and worry about potential episodes, which can significantly impede daily functioning and quality of life. Associated features: intense fear with physical symptoms versus ongoing worry about future attacks and behavior changes. When distinguishing between a panic attack and panic disorder, it's crucial to note that a panic attack is a specific episode characterized by sudden, intense fear, accompanied by physical symptoms such as heart palpitations, chest pain, shortness of breath, or dizziness. On the other hand, panic disorder involves repeated panic attacks coupled with persistent anxiety about having more attacks and the behavioral adaptations that might ensue, such as avoidance of certain places. Individuals with panic disorder may live in fear of the next episode, which can significantly impact their daily functioning and quality of life. Recognizing this difference is essential for effective treatment, as panic disorder may require more intensive or long-term therapy, possibly including medication, psychotherapy, or a combination thereof.